What is anxiety? Anxiety is a mental illness that causes distressing feelings and thoughts and can become overwhelming. People who struggle with anxiety could also experience panic attacks. This is a type of anxiety called panic disorder. Panic attacks are essentially a result of fight or flight, a response that was vital to survival back in the caveman days. It means that when faced with an alarming situation, one receives a surge of adrenaline in order to fight or run to safety. Panic attacks are a result of that adrenaline surge and can often feel as though you are dying or having a heart attack. They are both emotionally and physically draining. Social anxiety disorder causes overwhelming feelings of discomfort and self-consciousness in social situations. People with social anxiety could also experience a great deal of worry and stress regarding social situations. This leads to difficulty functioning in public places, such as school or at work. Phobias are a type of anxiety disorder that revolve around extreme and often irrational fears. This can lead to avoidance of situations and places. The most common type of anxiety is generalized anxiety disorder, which often leaves one in a constant feeling of worry or causes irrational fear and unease when there is little to provoke such reactions. Common symptoms of anxiety disorders are insomnia, panic, uneasiness, heart palpitations, shakiness, nausea, dizziness, and muscle tension. Obsessive-compulsive disorder, or OCD, is sometimes categorized as a type of anxiety disorder. It is a mental illness that leads to excessive intrusive thoughts and often involves carrying out compulsions or rituals to relieve the anxiety felt by such thoughts. For example, one could have an intrusive thought about hurting someone they love, and then feel an overwhelming need to turn a light switch on and off until it feels right. This is often with the irrational mindset that carrying out the compulsion will prevent the bad thing from happening. However, many people with OCD do know that their feelings are quite irrational, but feel as though they can't carry on unless they do the compulsion. Anxiety disorders could be triggered by stress, environmental factors, brain chemistry, substance abuse, and genetics. Treatment includes talk therapy, cognitive therapy, and medication. Whether you struggle with anxiety for your whole life or find a way to overcome it, it does not define you as a person.